Hi, my name is John Consalvi, and I'm here today with Dr. van Mersbergen from Northern Illinois University. Miriam is not only a professor at Northern Illinois University, she's also a professionally trained singer. We're happy to have her here today to talk to us about voice. Miriam, thanks for coming out.
Thanks for having me.
Miriam, how did you become a speech-language pathologist that specializes in voice?
Well, that's an interesting question. I was a music major in college and had aspirations to become a voice teacher. And at the time, I was looking for educational programs that would prepare me to be a voice teacher, and I didn't find any. So someone decided to suggest to me that I become a speech pathologist, at which point in time I had no idea what that meant. So I went to observe a speech pathologist at Loyola University Medical Center, and she was doing head and neck cancer therapy. And I remember distinctly realizing at that moment when she was helping an individual use another kind of voice that the idea of voice training was not just limited to singing, but it was limited to so much more. And I remember realizing then that that's what I really wanted to do.
What is the most important thing you do when you treat somebody with a voice disorder?
Well, I think that's a difficult question to answer. I think the first thing that we end up doing in voice disorder is assisting people in getting their voice back, and that has a lot of connotations that I think are as powerful as they seem. The other thing I think that happens in voice therapy is that because of so many of the recommendations that we have for people to drink more water and to quit smoking and to sleep more, people tend to take better care of themselves and then they feel better. So it's not just their voice that's getting better, but their general health and well-being seems to follow suit. And a lot of patients will say, you know, it's not just the voice that's changed, but I'm exercising more, I'm drinking more water, I'm eating more healthy. So that is also another benefit of voice therapy. But if I were to think about it further, I think the most important thing I do is I validate the problem. Voice disorders seem to be a problem that's hidden in plain sight. We don't necessarily hear someone with a voice disorder, but they may be experiencing the problem. They may hear themselves differently, or they may be experiencing pain in talking. And when one complains about that, their cohorts oftentimes don't recognize it. And oftentimes they'll say, people don't understand that I have a problem. They tell me to get over it. And so just the act of validation can keep people from feeling lonely and isolated and help them move forward.
Miriam, how can graduate students that are in speech-language pathology programs better prepare themselves to work with voice-disordered clients?
Well, on top of taking the required academic courses and going through the practicum, I think the single most thing that would help a graduate student become more prepared in voice is to work on their own voice and to establish a very high level of what I call vocal rapport. Be able to modify their voice in ways, make their voice more flexible, become better models in voice therapy technique. And I think that this is important for a number of reasons, but the most important is because when someone is sitting across the desk from you or next to you or by the piano, you're listening to their voice. And if you have a flexible vocal technique, then you can develop a sense of what that person might be doing with their voice that's causing the problem. I like to call this vocal empathy, that if you have a good sense of what your own voice is doing, there's a high likelihood that you'll be able to identify what someone may or may not be doing that inhibits their voice and causing the voice problem. So I think work on your own voice, take voice lessons, go to an active voice coach, do voice therapy yourself.
Miriam, thanks for coming out today. I really appreciate your time. I know that people that watch this will learn a lot about voice and voice disorders and that they'll find this information valuable.
You're welcome.